My name is Zakaria Matia. I am the head of mission for MSF in South Sudan. I'm based in Juba, and we are implementing different health projects in the entire country of South Sudan. Currently, the humanitarian situation which is unfolding in South Sudan is getting worse and worse day by day because of the ongoing conflict. Now, the epicenter of the conflict has been in Upper Nile, and now it has moved to Jonglei State. And we see that there's a lot of violence impacting on the civilians and violence impacting on our health facilities and our staff and our patients. And we have seen a lot of displacement, people fleeing from Upper Nile and crossing the border. It is estimated that more than 35,000 people have crossed the border to Ethiopia. And as I speak, the impact of the violence on our health facilities has been very bad, because one of our health facilities based in Ulang was looted in the middle of April. All the drugs, equipment, and all the funjan and other foodstuffs were all looted by more than 100 armed men who stormed the hospital in the morning. And prior to the looting, when the patients and the community heard that the military was advancing to that location, they started evacuating the entire night. And we are talking about patients evacuating where there is no infrastructure for movement. So patients, some of the patients were, like we had a cholera treatment unit. And in the morning we woke up, in the previous day there were 38 patients, and in the morning they had all fled. And we had 67 patients wounded in the hospital. But on the day they evacuated, all of them had to evacuate. And they were evacuating towards Ethiopia. And this trip, by walking, it takes many days. By boat, it could take more than 10 hours on the boat. So this has impacted very much. And then the recent incident in Old Fangak, whereby our hospital was bombed by helicopters, destroying the warehouse for all the drugs, and 4 of our staff were injured, and 7 people were killed in the market area. So this has really impacted on our work. With this unfolding humanitarian situation, whereby we have a huge number of refugees coming from Sudan, more than 1 million people have arrived in South Sudan, and then we have a lot of displacement, and then people are fleeing violence amidst the cutting of USAID funding. So the population in South Sudan is facing a huge crisis. So we are urging the authorities, the parties involved, to spare health facilities in South Sudan. They are really needed at such a time as this. And we are also urging the parties involved to respect the population, to respect our patients and the staff. They are not attacked, but we are there to support the communities. As we are approaching the rainy season, we are going to experience an increase in number of patients because of malaria, flooding, and this is the time when we are calling upon the donors to increase the funding for South Sudan. It is not the time to cut the funding for South Sudan. As we have witnessed USAID funding cuts, we have witnessed the UK, the Netherlands, and Sweden governments cutting aid to South Sudan. Yet, the crisis which is unfolding is exacerbating the suffering and is going to be worse in the coming months due to the unfolding situation.
So we have added an extra nurse for night shift because we will be getting